I'm Kelly Higgins-Devine. It's 22 to 2. If you were suffering from PTSD, post-traumatic stress disorder, would you consider taking MDMA or ecstasy to treat it? Steve McDonald is a retired Army Major who has PTSD. He's co-founder of a group called PRISM, Psychedelic Research in Science and Medicine. I began by asking him how long he'd served his country for.
About 15 years.
And where did you serve?
I served overseas in Somalia during the war there in 1993.
You developed PTSD as a result of your service. What symptoms did you experience?
Look, when I came back from the war, I also worked in emergency services as a helicopter pilot, and so I was exposed to a lot of trauma there as well, and the sum of all of that left me with PTSD. Fairly classic symptoms, things like anxiety, which can be triggered by sights or sounds or smells that might remind you of traumatic experiences, sleep deprivation, loss of interest in all of the sort of things that people normally do for enjoyment, like hobbies and those sorts of things, inability to concentrate. And it got to the point where I was not able to work at all. And most people who develop PTSD have what they call comorbid or accompanying depression. And I certainly had that, and I was by one point having suicidal thoughts as a result of the combination of PTSD and depression. And so I had to be admitted to a psychiatric ward.
Steve, if somebody had suggested to you, maybe you should take ecstasy as a treatment for this, not knowing what you know now, what would you have said?
Look, like most people who haven't had any exposure to MDMA or ecstasy, I guess I would have probably been in line with the propaganda that Stephen Bright was just talking about, which tells us that it's a dangerous drug, it can kill you, it's addictive, it damages your brain and all that sort of thing. So I probably would be very reluctant to go anywhere near it.
How did you come across this then? How did you learn that MDMA could be a treatment for post-traumatic stress disorder?
I first saw a media report, and this was back in about 2010, which was talking about the research being done by the organisation MAPS in the USA.
What's MAPS? Sorry.
MAPS is the Multidisciplinary Association for Psychedelic Studies, and they're the global leaders in MDMA-assisted therapy research.
Mm-hmm. Sorry, I interrupted.
That's okay. And the article said that the founder of MAPS, Rick Doblin, was coming to Australia to speak at a conference in late 2010. And because of my obvious interest in curing PTSD, I managed to get along to the conference and listen to Rick talk. And during his address, he offered $25,000 to try and get some research happening here in Australia. And I stepped up along with Stephen Bright and a few others to help found PRISM, our non-profit association. And as a result of that, I started to get access to all of the scientific information from the research being done overseas. And MAPS is very, very open with all of that. They publish their treatment manuals and their protocols for free download on their website. They're also a non-profit association. So as a result of that, I began to learn about the science of MDMA and the results that were coming from the research.
Steve, had you tried the conventional treatments? Had you gone through those processes?
I had. 10 years after my war service, I had a breakdown and was admitted to hospital. I was living in Melbourne at the time. And I went through conventional counselling. I was put on antidepressants. I did a 3-month-long group therapy course as well. So I went through the full, fairly intensive conventional treatment process. At the end of that, my PTSD hadn't been cured. I wasn't well enough to go back to full-time work. The Department of Veterans Affairs were disappointingly unsupportive, and consequently I found myself out of pocket about $25,000 because of not being able to work for 7 months and unable to go back to full-time work.
How was it affecting relationships?
Quite tragically, not long before I had my first breakdown, my marriage of 20 years broke up, and then that began a period of great difficulty, trying to enter in or sustain any kind of relationship.
So when you've made the decision to try MDMA as a treatment, What were your hopes at that time?
Well, I guess I'd read that the initial study in the US had a success rate of over 80%, and so I was very hopeful that it would be helpful for me as well. Unfortunately, I could not get the kind of therapy that's being used in the research studies. It just isn't available in Australia, and I was unable to get onto any of the studies overseas. And so I haven't ever had formal treatment with MDMA. The only experience I have had was self-administration on one occasion.
Okay, now for me, my first thought was, whoa, that's a bit possibly dangerous. Is that how you felt about it? Were you anxious going into it, I suppose?
Yeah, look, I must qualify that. It took me 2 years of thinking about it before I actually did it. Mm-hmm. And for the benefit of our listeners, I should also add that pure MDMA, laboratory-grade MDMA, is being used in these research studies, and it's I hear, very difficult to obtain elsewhere. And
okay, so it's not going to a rave party and, this will do the trick for me.
Exactly. Yeah. It's not buying an illegal drug on the street. And the problem there is that often what's sold as MDMA or ecstasy may not contain any MDMA at all. It may be a mixture of other drugs. So it's very, very dangerous to try and do that. I had the benefit of access to all of the research results. I had access to information like what dosages were being used, the time frames that they were being used within, and all that sort of thing. So I was very, very well informed, and it took me quite some time before I could find a place where I could access pure MDMA.
When you did, what happened?
I followed the MAPS research protocol in terms of the dosage. I had a friend sit with me to watch over me for safety, and the experience was unexpected for me. I had never taken an illicit drug before, not even marijuana, and so I had no prior experience to shape my expectations. I thought maybe I would go through some process of revisiting traumatic experience, but that didn't happen for me. What happened was I started to feel quite euphoric. I felt the energy from the medicine change my body. My body felt like it started to glow in a very, very pleasant way. My friend that was sitting with me played some background music to help the process. And I really just sat in what I can only call a state of ecstasy for some hours, and then started to come down from the experience. And there was no therapy whatsoever, of course, because there was no therapist present there. And after that experience, I went to sleep, and I woke up the next morning. And the next morning, I noticed that my background anxiety levels were far reduced from what they had been. In fact, I felt so well the next morning I couldn't remember ever feeling that well in my life. And there seems to have been a sustained improvement, from that experience. And so it was a very simple experience for me. It's not classical. If you read the research, often people do go through their traumatic experiences and review them, but it didn't happen for me. So what they told me was there's something inherent in this drug, MDMA, that is very healing. And obviously it works very well if accompanied by psychotherapy, but it also, in my case, worked without psychotherapy.
That is so fascinating to me that you felt immediately better once you'd come off the high, so to speak, that you were still feeling the benefits of it. Has it been ongoing?
It has been ongoing to some degree, yeah. I must state clearly that it hasn't cured my PTSD, rather. Mm-hmm. I still suffer from PTSD symptoms. But there has been, a noticeable improvement that has been sustained, yes.
What sort of things are better?
I think the main thing is just my background anxiety level. When I had PTSD previously, prior to taking MDMA, my background anxiety levels were quite high. That's typical for someone who suffers PTSD. You're always on edge, and you can be triggered, into a full-on anxiety attack fairly easily. And I found that my sort of threshold for being triggered is lower than it used to be, so I can tolerate things, more than I used to be able to.
So what is PRISM and what does it aim to do?
So PRISM's a non-profit research association that was created in early 2011 as a result of that conference that I mentioned before. We've been trying ever since then, in close collaboration with MAPS from the USA, to establish some research here in Australia to look at MDMA-assisted therapy to treat post-traumatic stress disorder. And we are starting small. We just want to do a very small study of maybe 10 to 20 people. Those people would be sufferers of PTSD who had a history of not responding to conventional therapies. In the proposed protocol, we would give them 2 treatments of MDMA, probably, around about a month or so apart. And then that would be accompanied by some psychotherapeutic sessions, which would begin before the first MDMA session and would continue on after the last one for integration. So around about 11 or 12 sessions altogether with just 2 drug sessions.
Do you feel like there's a movement towards that the barriers are breaking down to allow a trial of some sort?
Look, it's been a very slow road. What we've found is that both the academic profession and the medical profession in Australia are extremely conservative and quite afraid to look at anything to do with an illicit drug, even though the research that we're proposing is going to be fully legal and fully approved by the government. People don't want to be associated with it because they fear about their professional reputations, or from an institutional point of view, they fear that they might lose their funding sources if they're seen to be working with one of these taboo drugs. So it's been a real struggle. We've spoken to some of Australia's leading PTSD researchers. We've spoken to a number of universities, and every time the answer is the same. Sometimes we'll strike an individual who is interested, but then they'll be squashed down by their institution saying, no, we can't do that here. We are sort of encouraged by what's happening with medical cannabis, clearly, and I think it's probably mainly because of what's happened in the US that, Australia tends to look to the US as a big brother, and if it's okay for them, well, maybe it's okay for us. And we're hoping that something similar will happen with the MDMA therapy.
Steve McDonald, it's been just wonderful talking with you. Thank you.
Thank you, Kelly.
Steve McDonald, retired Army Major who has post-traumatic stress disorder, co-founder of a group called PRISM, Psychedelic Research in Science and Medicine, talking there about the use of MDMA or ecstasy to treat PTSD.